You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, nobody should be wearing a loose-fitting denture. He is one of the pioneers of implant dentistry, Dr. Periklis Proussaefs. Dr. Proussaefs, welcome to the program.
Great, nice to be here, great.
Now, your patients call you Dr. Perry.
Yes,
much easier.
It's much easier. We found over time that the last name is too long for people, so it's easy for people to remember, to recall.
Now, before we get into today's topic, we should mention you brought some before and after photos. We'll get to as many of those as possible. For people that don't know your center, who's the typical dental implant patient?
Hard to say. I wouldn't say there is a typical implant patient. In our practice, we have patients from all walks of life. If we have to somehow categorize them, I would say we have patients coming with dentures, have no teeth basically. And they have dentures for a number of years, looking for something more functional, better solution, because they need some help. And we have another group of patients, so either they know deeply that they're about to lose their teeth, or they have been told by other dentists or the centers that they're about to lose their teeth.
And most of these people don't want dentures, right? That's why they go to you.
Yes, they don't want dentures, or those who have dentures already, they know there must be a better solution. They have been told, or they want to explore their options, the possibilities for something better.
We're talking about dental implants today. We should mention everything pretty much we're going to talk about today. You teach other dentists at your training center. Is that correct?
Yes.
You teach dental implant dentistry.
Absolutely.
Loma Linda, you're a professor.
Yeah, it's something I believe it's a very complex science, if you want, implant dentistry, interfaces with bone anatomy, surgery, prosthetics, laboratory. It took us many years of studying, effort to bring to a level where we do everything from start to finish. And this is an endowment, if you want, that needs to be passed to other dentists.
Okay.
So I've been teaching Loma Linda 20 years now, and we have in our office, next to our office, a center where dentists come from around the state, around the country, to get educated on dental implants. Yes.
Does it cost more to go to a guy like you? I'll put you on the spot.
Actually, no. You know what costs? It costs less because what procedure costs less. This is done once and it works.
Okay.
So, see, in a typical scenario, from a practical standpoint, is that a typical patient you have to go to one center for imaging, then you have to see somebody who places the actual implants, and somebody who restores them.
Who puts the teeth on top.
Put on top of, yes. Restore means to put the teeth on top and put basically the pieces together.
So it's like 2 or 3 people involved.
Yes.
But you do it all.
By the way, actually 4 people involved is a technician. And we have in our office all the technology. Nowadays, things are done in a computer. So we have the computers in our office. We have the ability to sedate patients, to do the sedation, we do the surgery, and also we do the teeth for them.
Tell me this. If somebody's watching this right now, and if you had availability on your schedule, pretend this is a Monday, they could have their teeth on Friday?
They can have their teeth by Friday or earlier.
Are there a lot of people wearing dentures in your area?
There are a lot. It depends on which study you want to follow. See, people who wear dentures try not to engage with others much. They're more secluded. It depends which study you want to follow. Recent publications show that about 40 million people in America, they have either upper or lower jaw with no teeth.
Okay.
If you do the math, it's about 12% of the population. Cities will feel, for example, we're close to LA, to Los Angeles. This is 12.5 million people in metropolitan area.
Okay.
They would fill this 12% 70 or 80 times the Staples Center.
With denture wearers?
Yes, denture wearers doesn't include people who are about to lose their teeth.
So it's a big problem.
So it's a big problem. So if I got to practice for 300 years more, I wouldn't be able to help them.
Okay.
So it's a big problem.
Is this true? And I'm going to jump around here, but on the day of the procedure, somebody could walk in with no teeth and walk out with upper and lower teeth that don't come out in your center. Is that true?
It's true. Nowadays, you have the capability to do this. Basically, in a nutshell, we see the patients, we may assess their expectations, we do a couple of records, we have to collect the data, and next, we prepare for surgery. Now, during placement, we sedate them, so you don't have to be awake during the process.
So they're doing what, IV sedation?
IV sedation.
Okay.
Actually, by the way, we teach also sedation to dentists.
Okay.
Because in the field, we have been doing this for a very long time. We do believe the process doesn't have to be painful.
Okay.
And nobody wants to remember the process.
Okay.
All they're going to remember is the teeth after. And of course, the joy they're going to receive from using them. So, with the effect of the sedation, takes the memory away, patient's relaxed, end of the day, procedure is finished, and we can have fixed set of teeth. Fixed means they're permanently anchored on the implants.
So they don't come out.
They don't come out. They don't come out. This is a tremendous service you can offer to patients. The feedback we have been receiving from patients having this from relatives, spouses, has been tremendous.
Now you brought some photos. What are we looking at over there?
So look at this before photo.
Yeah.
This is how the patient walked to our practice. A very typical patient that we see in our office. Pictures like 1,000 words. You can see the smile, which basically you can see the teeth have a lot of problems here, from gums causing infection, bad breath, things breaking down. And we look at the picture. One thing I learned over the years, we dentists don't fix just a smile, the teeth. We help patients change their lives. We don't change their lives, they change their lives.
Okay.
However,
Okay.
we give them the confidence they need to change their life. That's what what patients have been telling us over the years, and you can show in the next picture the difference.
So he doesn't smile.
Doesn't smile.
That is his smile?
That's the best you could have him smile. So one option was to have a denture. He would never see him having a denture. His family, his wife, never imagined him with a set of teeth that will come out in and out all the times. And if you look at the picture, the way his expression is, the way the picture is like 1,000 words. It doesn't look happy, doesn't look confident.
When you meet this guy in person, do you see the end result? Do you think, wow, this is going to be good?
I saw the end result because I have done this many times.
Okay.
Then the challenge to convey this to people, and with which I have been doing this over and over again.
Okay.
So it's something I feel confident about. But what happens is that when we do, everybody, all people, when we have a sense that we don't like something about ourselves, can be the teeth in our case, can be something in the nose, anything. We don't bring our best. Always more reserved, always less social, less friendly.
Okay, like self-conscious about your teeth.
Absolutely. Then we sedated him. We took one appointment to collect records, basically to make some impressions, some molds, some scannings, and then we put him to surgery. Sedation. So he was sleeping during the process, and this is how things look after. This is
It looks
a
good.
different smile, and see the confidence. So what happened to the shy, afraid? Doesn't look the same person anymore. And he doesn't, the nice thing about this, he doesn't act like the same person anymore.
Oh, really?
Really, he's just more friendly, more talkative, chit-chats with the front desk.
Okay.
He dresses better. Before you see baggy clothes, basically doesn't want to meet people. But does he look more handsome?
He looks more handsome.
Does he look more friendly?
Yes, he does.
Does he look more approachable?
Yes.
So,
That's what teeth do.
see, one thing when I was in dental school, I had an impression that we're trained to fix teeth. Over the years, I learned that we help people to bring out their best.
That's good.
That's the biggest privilege dentists can offer you. But it takes time to offer this. Next, yes, very similar situation. Patient secluded, basically, wife complaining that besides the functional problem, he doesn't chew his food, he has stomach problems because he can only eat what he can. Personality-wise, you can see somebody who doesn't seem friendly, doesn't seem very social.
Yeah.
And if you look closely, doesn't look happy, look sad, look at the frown, look at the angulation of his lips.
Okay.
Only because no teeth, actually, this gentleman was about to lose his teeth, and it was impossible to have him smile.
So his option was a denture also.
A denture option,
But no
one
way.
option, but
No
for
way.
some people, for most people, it shouldn't be an option. For him, it was out of question.
Okay.
Out of question. And this is how he would look, and he looked after the procedure.
Very nice. Very nice.
So all of a sudden, he changed personality.
Yeah.
More friendly, more social. The procedure itself takes a couple of hours. We sedate him. Again, we place the implants. Little pegs go inside the bone to stabilize a set of teeth. And thanks to modern technology, we're able to place those.
Is this one of those things where they
Same
say,
day.
Dr. Perry, did they say, I should have done this years ago?
We hear this all the times. Another thing I heard recently and blew my mind, again, these people are in the early 80s, late 70s, is this is actually when they take a mirror.
Yeah.
They say, oh, this is the first day actually of a new life.
Okay, good. You make it sound exciting,
It
right?
is exciting. It is exciting. Actually, the more exciting part of what we do is a time when we give them the mirror to look at themselves.
Do they ever cry?
Half of them, they cry.
Oh, they do.
They do. They do. Get everybody emotional because they realize how much they have been missing and how much better quality life they can have after. And it's hard sometimes to put our shoes in the denture patient's life, or somebody who's about to lose his or her teeth. They don't socialize much. If they have a spouse, they have to find a way to remove the teeth, not in the presence of the spouse. They don't like to engage with people. They don't. They go to a restaurant.
Is that what they tell you? They tell you this.
Basically, the stories I'm hearing is that they go to restaurants. They have to look at the menu to order what they can versus what they want.
Okay.
Some of them, they missed. I never had a salad for years. I never had a juicy steak. I love to have it, but not from me anymore. So the best actually thing you can have is to bring them this experience back to them.
That's nice. Well, tell me this. Backing up, you said that there's, let's say, 500,000 people in Orange County, LA County, San Bernardino County, Riverside County, Ventura County. There's like 500,000 people with an upper lower denture. Okay. If it's so good, why aren't they all doing it? What's your take on that?
My take of this, it's a couple of reasons. Okay, one reason is that let's bring them back to the life how it was before they end up with the dentures. They have millions of appointments back and forth to the dentist because they were sensitive, they had pain, they had bad breath. So somehow when they get a denture, they feel relieved.
Okay.
They feel, okay, I'm through this. So I don't engage anymore with the dentist. I don't go to the dentist unless I have a sore spot. So their options were never present to them.
So they don't even know?
They don't even know.
Okay.
It's like to somebody, there was some resistance. I don't know if it's a good example, but 120 years ago, people used to say, why need cars? With horses, who conquer the whole world. From the Roman emperors up to the first American presidents, they had horses for transportation.
Yeah.
So why have cars? What for? The same mentality. Because they have been denture, I have a denture for 5 years, 6 years. Nothing bothers me.
So they don't know how good it is.
You don't know the other side. You haven't seen what you can have. Another category is patients that are afraid of pain, they're afraid of that it's going to hurt them. Nowadays, we offer sedation.
I mean, they're numb, right? I mean,
they're numb. During the process, there will be no pain at all.
Okay.
Because you numb them. We sedate them, so they're half asleep, half awake during the process. So this is not an issue. Yes, there's some discomfort after. It's a surgery still. But the process itself shouldn't create any fear factor to avoid the benefits of what you have. Another category of patients is that they have been told some places that, you don't have the bone.
But it is true though, isn't it? I mean, if you've been wearing a denture 10 years, you can't do this because you don't have enough bone.
With the techniques we have nowadays, this is not the case anymore in most cases.
Okay.
We have imaging techniques, three-dimensional, so we can see exactly where the bone is.
Do you ever turn away people and say, sorry, you don't have enough bone to do this? Does that happen?
I try to remember. No. Honestly, no.
Okay.
There's always a way to do it. Okay. There is some case, medical, as far as medical condition, there is somebody is very sick, has serious medical problems, just go first. We know that.
But if somebody's in, like you said, you've done 80-year-olds, they're on medications.
However, I have some, like a touch of diabetes, I have some osteoporosis, I have been told. That's not an issue. They are predictable in any age.
Okay.
Age is not a factor, actually.
How old can you be? What's your oldest patient?
My oldest patient, he was honorable, tremendous personality guy. He was 93 years old.
Why would a 93-year-old want to do this?
Let me ask you a question. It's a brilliant question. Thanks for asking the question.
Okay.
He was a perfect example. He was socially very active. He was the former mayor of the city. So he still want to go see his grandchildren. Grandchildren give him food to eat. He want to be socially active. And in this case, years ago, eventually he passed at the age of 101 years old.
Okay.
So the last 7-8 years of his life were joyful.
That's good.
So he able to take his wife to dinner. His wife was same age, 93. She didn't need implants, she had her teeth. But he was able to engage with his grandkids, friends, go out to eat. And he had a nice life at the last 8 years of his, basically of his life. So that's the reason. Another reason is people want to become still socially active. People date, they want to go to hiking, they want to play tennis and don't want to be worried that they are gonna lose their teeth during play tennis. They have also expectations that some of them still work, still active. at the work. One of the patients who did, he was an accountant. And actually his wife who works with him, he noticed he doesn't like to see clients anymore.
Okay.
He dedicates the work to other people at his work. And then after he got his teeth, all of a sudden, he loves seeing clients. Clients loved him. Why? Because he knew has something.
So self-confidence came
saying
back.
it's very important self-confidence.
Okay.
Also, you look more friendly. You want to look friendly to people. Who doesn't want? Let's get an example. You go to a country where you don't speak the language.
Yeah.
So you cannot understand the conversation. You ask something to somebody, and this somebody responds to you with a big smile.
Okay.
Does this person look friendly to you?
Yes.
Yes. Did she or he say anything to you to justify your perception?
No.
No.
Just a smile.
Just a big smile.
Good.
So it's a lot of reasons people come. And nowadays, 75, 80 years old is not old at all. They can still want to enjoy food. They still want to have confidence. And they still want to feel part of the society. They don't want to be secluded. Feel that something is preventing them to bring out their best. Okay, let me show the next case actually. Next patient.
Okay.
This gentleman here, he was unfortunate to lose his teeth early in life. He went to other places. He was told the same story. Not enough bone. Actually, somebody offered him to do a hip graft where you take a bone from your hip, wait for 9 months to heal, many surgeries. So he
had no upper teeth.
He had denture, which he hated so much that he rather not have any teeth at all than the denture.
Okay.
So yeah, he had an effort to have a denture. He had an effort to get used to this with no success. So he came to us and we look at the situation. We took some 3D imaging, which you can identify bone at basically areas that's...
Oh, it's a young guy.
Very young guy, late 30s.
Looks good.
So in this case, he went to different centers basically. He was told that no bone available.
Not enough bone to
Not
do
enough
it.
bone to put implants. He had, they offered him denture. He had a denture. He made a serious, very serious, sincere effort to get used to the denture and use it.
He couldn't do it.
There was no way. So he elected rather not have any teeth at all than a denture.
Okay.
Of course, everybody's different. Some other people don't feel the same way. But in his case specifically, at that young age, was out of question. So he came to us, we do the 3D, three-dimensional X-ray. We look at the bone, see what's available. Nowadays, there are modern techniques that we can use every inch of bone that's available and give you teeth. So, the beauty. He came. We sedated him. He was out. He walked out with a fixed set of teeth.
Nice.
Unbelievable. So, the wife called on the phone afternoon when he came home, screaming from joy. Wow, that's a miracle. Scream from joy. Guess what? She actually made an appointment. She was missing 2 teeth next week. To another
So now you're helping her too.
But,
Yeah, I don't want to rush you, but I know you have a stack of photos, so we're going to go through the rest of these. This is very good, by the way.
Another thing, this gentleman here, actually he was, you need to a little bit understand where they're coming from.
Okay.
This gentleman here, freshly retired, just retired.
Just
And
retired.
he wants to enjoy his life.
Okay.
He cannot go to dinner. He cannot date. He cannot have social life. Because that's why his smile is. I cannot enjoy the fruit of my life. Still young, 75, 72 years old nowadays, not old at all.
Okay.
This is how he looks.
Very nice.
Picture is like 1,000 words. You can see the confidence, the joy. He goes to the gym, hour and a half every day.
Okay.
Not because of the teeth. The teeth gave him the confidence to improve his life. He's dating. Actually, every time we go there, he asked me last time, do you know of any good steakhouse? For you,
So they can eat
for
whatever
me.
they want
Pretty
with their
much,
new
yeah.
teeth.
Pretty much, yeah.
I mean, if you can eat
you
them
can go
with
to the steakhouse. You can go to steakhouse. And you're asking me specifically what steakhouse to go at. Next case, young lady. She was told that she was about to lose all her upper teeth. For somebody young to be told this is traumatic. So she came to the office fearful, traumatic, like devastated. How is going? She was not ready mentally, physically, functionally for a denture. So same situation. We remove her teeth, we sedate her, and this is the after. She came full of confidence,
Very nice.
full of joy. She was able to keep on her life, personal life. Actually, when we first met her, the same story, very reserved. So today now, she enjoys life. You can tell the way she dressed, the way she chats in the front desk, the way she communicates with everyone. Before the clothes were baggy again, like before, also neglected, but like she didn't care. Once she was told that she's about to lose all her teeth and have this denture when we remove your teeth, the face collapses, I can sense she was crying. She cried 2 times. One, when she came for the interview, told us what she knows already.
Yeah.
And the second time, she couldn't stop crying when she held the mirror.
Good.
Reactions
Good.
from people I see every day. She took a selfie and she sent the picture to every single friend. So how do I look? How do I look? Blast email to everyone. Wow, fantastic, beautiful. It's one of the stories that satisfies you on what you do. And most important, the patient will help you to reestablish your life from a devastation standpoint to go more optimistic, more friendly, more healthy.
Do you think in the future dentures won't exist? Like everything will be attached to dental implants? 20 years from now?
2
30
years from now. They may still exist for very limited cases where people have not health-wise able to go through surgery, but for 99% of the cases, no.
Okay, good.
Actually, they shouldn't exist today. The future is now. You have the technology, you have the tools to do it. There's no real reason to reserve from doing this.
Yeah, but I got to ask you this because I want to ask you, if you have bad gums though, can you do this? Like, will the implant stay in there if you have bad gums?
But Randy, this is exactly the case you have in our office. That's why one reason people lose it at first place.
Okay.
Because they have gum disease. Gum disease somehow eats the bone, less bone available.
You clean that up?
You clean it up. We graft if we need it, but we clean it up. We prepare basically the area, the site as we call it, and then we place the implants on the bone that is available. What have been said, the earlier you seek treatment, the better chance to have success. Why? Because they have more available.
Okay.
So if you wait too long, still do it, but it's more difficult.
For you?
For us, the results are the same, no matter what. And I'll tell you a story. It happened just 2 weeks ago. Probably is one of the highlight cases. Patient came in to do the same type of procedure, implants upper, lower. She knew it was the end road for her. I tried to take a picture from her before. She said, oh, no, pictures. I haven't taken a picture for myself for 20 years.
Okay.
With all the stuff myself would jump. Okay, fine. We didn't pay attention why, how. Maybe it was, we didn't actually evaluate that much. So maybe it's just her choice. I have relatives in New Jersey, here and then in Europe. They haven't seen me how I looked last 20 years. Fine. We didn't insist, of course. We did the procedure, we did the surgery, we give her teeth. So we put the mirror in her mouth, in her face. I said, can I take a picture for you now? 20 years after, she took a last picture of her life.
Wow.
And what she asked?
What?
Can I have a makeup to take the picture?
That's nice.
Incredible. So she took the first picture after. So what was bugging her, she didn't tell us. She didn't know herself either. That the teeth, the smile, the lack of smile prevented her from seeing relatives, seeing family. And another case actually to show you.
This is our last one. We're short on time, but keep going.
This
Very good.
Gentleman, just look at the smile, lack of smile, I would say. You see the reverse smile. I cannot even do this. The smile goes like a U-shape.
Yeah.
So this gentleman he haven't seen his relatives overseas for 20 years. He was about to travel to see them 20 years later. I can't go like that. So that's after. Implant set, actually, I remember the case like yesterday. It was a very emotional case from our office. He was crying, my staff was crying, everyone was crying. Monday, we delivered the teeth. Thursday, he had the flight to go back to his home country. 20 years later, he hadn't seen his sister for 20 years, but he was shy to go with this lack of smile. It affected his confidence, affected his self-esteem, his presentation. It made him more remote. And he saw his sister, came back, he saw his pictures. He brought some gifts from his home country. It was like we felt part of this in the whole office. Do have time for one more?
One more.
Okay, this is a very representative case. People are here. I'm too old to have teeth. I'm too old. I'm too weak. This gentleman, 83 years old, came to our office. He was about to lose all his teeth. Now he couldn't smile any more than this. For him, everybody comes to a different walk of life.
Yeah.
For him, it was about enjoying food with his friends and family.
He just wanted the food to eat.
And it was painful to chew because any kind of problems, gum problems, sensitivity, cavities on the teeth, things, broken teeth. So same situation, we sedated him, we removed his teeth, we clean up the bone, the gums, everything. We placed a couple of implants, upper jaw, lower jaw. We gave him back his smile. If you look at the smile before, after, mostly look how he engages with me, with the staff. 90% of the communication studies show it's body language.
Okay.
It's less what we say, it's how we say it, and how we position ourselves body. Look at the way he presents himself. Do you see somebody 83 years old and he's tired from life, he feels, so he says, oh, I'm too old, I'm too weak, I'm too sick. I'm too secluded. It's the opposite. Now he comes to the office full of
And he wanted to
confidence.
eat. What,
For him, because
what did he eat?
They start from be able to go to a restaurant and not a salad. To be able to have steak, you can have basically dessert which has nuts inside. You can buy it on nuts, on crackers.
Nuts,
again.
okay.
They have cereal for a long time. You can crunch it. He was tired to have mashed potatoes. His diet was mashed potatoes, eggs, rice, repeat.
Okay.
That's it. So this is diet, not very healthy diet because it's high carb. Besides that, you don't enjoy. So at certain stage in life, food becomes, it's always a privilege to eat what you can, always a privilege. But certain age when basically hit 70s, 80s, to be able to choose something and enjoy it, it's priceless.
We're out of time, but we haven't even really mentioned, I mean, you're board certified in implant dentistry. Is that correct?
Yes.
Prosthodontist. You teach dentists from all over the world, or is that an exaggeration? Is it mostly in the U.S.?
It is around the world, either through publications or through lectures and training. Actually, they come from other places to our center to receive training in implants.
To teach it.
And it has been a while. We do this for a very long time. It's very engaging. It's one of the best, satisfaction I have is to go online and see emails from all around the world, from Brazil, from China, from Australia, Europe, Russia, you name it, asking my opinion about, we do research, University of India. What do you think about this? And I spend time engaging with them as far as helping to develop research projects, helping them to publish a paper, review papers. So this interaction, it's actually the edifice of bringing our science to the highest level.
Hey, we're out of time.
Okay,
Final statement. Somebody watch this. They're either wearing a denture or they have really bad teeth and they're worried about ending up in a denture. What do you say to them? They're skeptical. They're afraid. They're watching this, but they're still afraid.
There's no real reason not to explore your options.
Okay.
You deserve this. Do this for yourself. At least come for a consultation. Hear out what can be done.
Okay.
Because I hear this over and over again. I'm kind of okay with the denture. I'm fine. But it's explore your options. You deserve this. Your family deserves this. You're going to have your friends.
The family?
Yes, because be more friendly.
Okay.
You're going to be more happy.
Okay.
You're going to be a better person on the Thanksgiving table. This I can tell you. So see the picture you have. Will you have somebody next to you on the Thanksgiving table like this, or somebody happy?
Good for you.
You pick one. Which one will you like?
All right. So no more dentures. Thank you for coming on the show. Good stuff.
Nice coming.
Good
Great,
stuff. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.